Welcome to Baycare Health Chat. I'm Maggie McKay. Heart failure is nothing to fool around with or ignore. It's a serious condition that needs medical care, and the more you know, the better. So today we'll talk about the symptoms, causes, and treatments of heart failure with Dr. Jay Amin, a cardiologist specializing in the diagnosis, treatment, and management of heart conditions in patients at Baycare. Dr. Amin, thank you so much for joining us today to talk about this important topic that affects so many people.
Yeah, thanks for having me. I appreciate that.
Absolutely. To begin with, what is heart failure, and are there different types of it?
Yeah, so congenital heart failure is a condition that's common in our population of patients that we see typically in the United States, and it's characterized by symptoms of shortness of breath, fluid retention, swelling in the legs, and typically what it's related to is the fact that the heart muscle as a pump is unable to pump the flow of the blood forward, and as a result it backs up, and patients develop congestion in their lungs. They have difficulty breathing. And there's another type of heart failure where, though the heart muscle pumps normally, it just doesn't relax properly. And as a result of that, patients can get congested with the backup of the fluid in the lungs, causing symptoms of shortness of breath and fatigue and difficulty doing their activities of daily living.
And you said it's common. Are there any statistics? How many people are we talking about that are affected by this?
Yeah, no, it's a common condition. We've been overloaded with all the COVID-19 and the pandemic. But, if you look at the United States of America, there's probably about 6 million people in the country that have a diagnosis of congestive heart failure. And every year, unfortunately, there's probably 900,000 new cases. And so this will only continue to worsen as you see in our aging population. I mean, there's 10,000 individuals that are baby boomers every day. And so it is a condition associated with aging of our population. So it's only going to increase. And unfortunately, if you look at the number of patients, perhaps over the age of 40, there's a 20% likelihood that patients will develop in that age group over 40 symptoms of heart failure during the course of their lifetime. And it's a huge economic impact and social impact within our society. And the cost is extraordinary. I mean, it's extraordinarily high, and it's probably $30 to $40 billion per year. But by maybe 2030, thereabouts, it'll be $60 or $70 billion. So it's a huge economic impact within our society, and a huge social impact, and it affects a lot of people.
You mentioned age. What other risk factors are there? Who is at greatest risk?
Yeah, it's patients that tend to have a history of some other medical issues. And the things you think about are ischemic heart disease or coronary artery disease. So those are the patients that have had blockages of their arteries to their heart or have had prior heart attacks where the heart muscle is diseased or damaged. It used to be several years ago or decades ago where hypertension was the main cause of congestive heart failure, and that tends to be also a predominant cause in the patient population that we see now. But hypertension in itself is a huge risk factor. We'll see heart failure in patients that are, for example, diabetics, patients that are obese with valvular heart disease, and valves are within the heart itself are structures that they're like gates within the heart. They open and they close, and if they get diseased over time, that can lead to heart failure. With the COVID-19 pandemic, we've seen cases of what's defined as myocarditis, which is inflammation of the heart muscle leading to heart failure. And then interestingly, there is a condition called stress-induced cardiomyopathy, believe it or not, where patients are under tremendous amounts of emotional stress, which can lead to a diseased heart, where the heart muscle is not pumping as well as it should, which can lead to symptoms of congestion, being water retention, fluid backing up in the lungs. So there's a multitude of causes. Unfortunately, we've come a long ways in terms of advancements in treatment.
What signs or symptoms should we be aware of?
So the bread and butter symptoms, there's several, but we always focus on breathing. Are you short of breath with activity? Are you able to do the activities during the day with no symptoms at all of shortness of breath? Or are you noticing you're becoming more winded, going up a flight of stairs, doing the laundry or going for your daily walk. Then we zoom in on more specific symptoms. Are you noticing that your legs are getting a little more swollen, that you're retaining maybe a little bit water? There's what we call edema. Are you short of breath at night? Are you able to lay flat in bed? Or are you wheezy, more fatigued? A lot of patients present very subtly with symptoms of heart failure, and a lot of these patients are elderly. Until you really, zoom in with some questions and asking about these specific symptoms, it's sometimes difficult to tease out.
And you mentioned a couple of causes of heart failure. What would you say are the top few?
In the United States of America, I think, for a long period of time, hypertensive heart disease. So these are patients that have a history of hypertension, maybe not well controlled. Perhaps they're not watching their salt intake, they're not watching their diet, they're obese. But now we're also seeing a lot more patients that are younger with what's called ischemic heart disease. So these are patients that have had, with high cholesterol, that are diabetic, that are smokers. They may have had a heart attack in the past. Their heart muscle, which is the heart is a pump. And if you damage that pump, the pump doesn't work as well. And so ischemic heart disease is playing more into patients that we're seeing now with development of congestive symptoms, with volume retention, fluid retention. We see it in a lot of our elderly patients that are females that are over the age of 80 with hypertensive heart disease, never had a heart attack or a stroke, or otherwise they're doing okay, but they're just not watching their salt intake. They're eating a lot of frozen foods and processed foods. And they develop heart failure on the basis of the fact that they're retaining just a little bit of extra fluid and backs up in the lungs and they can't breathe. And that's a component of a heart failure that we see a lot of commonly in the United States.
Dr. Amin, what does diagnostic testing involve for heart failure? How do you test for it?
Yeah, there's a number of tests that we do. A lot of diagnosis for heart failure is just based on clinical examination and symptoms. But there are some additional tests that we can do to try to sort some of this out. We'll do chest x-rays looking for evidence of, vascular congestion or fluid in the lungs. We'll examine them. We'll see if do they have signs of the fact that there's a lot of fluid or extra water on board that's swelling in the legs. Do they seem that they're gaining some weight unexpectedly for reasons? And then we delve deeper with doing what are called ultrasounds of the heart or echocardiograms, looking at heart function. And sometimes on those ultrasounds, we can determine, is the heart function normal or is it abnormal? Are the valves that are in the heart that are responsible for kind of regulating the blood flow within the heart, are those normal? There's a lot of diagnostic testing we can do. But fortunately, with this testing, we've made a lot of improvements in terms of not just diagnosis, but treatment.
And when it comes to treatment of heart failure, what else is involved? What can a patient expect?
Yeah, so, unfortunately, heart failure is treatable. There are a lot of medications that we have in our toolbox. So it's not uncommon when patients that have had their first episode of heart failure, they wind up within the hospital. We treat them. We give them medications, whether through intravenous medications, through an IV, or medications, whether it be a pill form. We try to get rid of that extra fluid. Those are medicines called diuretics. And then based upon what the other tests show, there are medicines that we use to treat their blood pressure. There are medicines that we use to treat their heart failure that affect their volume status. And then we also look for, again, the cause of the heart failure, and we try to look to what can we do to prevent this from happening again. In some patients, it's just not watching their salt intake and not watching their diet, and we can attack that. In other patients, they have more severe conditions, whether it be valves leaking or if their heart muscle's weak. Could they have underlying coronary artery disease with lack of blood flow to the heart? And there's what's called cardiac catheterizations, which we can do to look at the arteries to make sure the blood flow to the heart is normal. So there's a multitude of tests that we can use and a number of medications that we can use to help optimize their status and improve their functional capacity and prevent recurrent episodes of heart failure.
That's encouraging. What's the overall prognosis based on? Severity, age, type of heart failure?
Yeah, no, very good question. And so when we look at patients with heart failure, unfortunately, if you get admitted with heart failure within the United States of America, The mortality rate can be as high as 25% for readmissions within the next 30 days. We've made great advancements with following up with the patients in the office within a 7-day or 10-day horizon, adjusting their medications and kind of instructing them, educating them, and optimizing their medical therapy. The fact that we're doing better than that now. And so I think a lot of heart failure, both treatment as well as prognosis, has improved over time. The important thing is, I think, education with patients and finding out what the cause of the heart failure is and trying to treat the underlying heart conditions such as hypertension, obesity, things like weight loss. Monitoring your weight on a daily basis is important. Watching your salt intake. If you're a smoker, getting off the cigarettes. If you're a diabetic, focusing on diabetes management. If you've got a history of valvular heart disease, trying to assess the valvular heart disease with testing and determining whether or not we need to do additional imaging or testing to fix the issues with the valve. So there's a lot of things that we can do in 2022 that we couldn't have done perhaps 20 years ago. Still, it's a very common condition. I think we've made a lot of advancements in not just treatment, but also helping out with prognosis.
Dr. Amin, what's your advice on prevention of heart failure? And once you have it, why BayCare is so outstanding in treating it?
Yeah, another excellent question. I think prevention is so important within our healthcare system, not just at BayCare, but nationwide. Any congestive heart failure is a chronic condition. So what I mean by chronic is that, once you get diagnosed with it, it goes with you for the rest of your life, just like diabetes, just like hypertension, just like high cholesterol or hyperlipidemia. So what we need to focus in on is what can a patient do to help with their long-term outcomes, their long-term prognosis. And what I tell patients is focus on things that you can control. Things such as, are we exercising? Are we watching what we're eating? Are we watching our salt or intake of foods that perhaps aren't really helpful for us? Foods that have a lot of salt in them, it's just not helpful. Watching our intake of saturated fats. At home, cardiology has been blessed because we can monitor patients remotely from the standpoint of blood pressure monitoring. What's your blood pressure running? What's your heart rate running? What is your weight? That's a really important marker for decompensation of heart failure. So I think having patients involved in their care gives them a little more control of the disease process because you want to get them involved as well. And these things are important as they go forward because though this is a chronic illness, we can still treat this long term. But you've got to have patient engagement. They need to know what they need to do at home, watching for any symptoms. And sometimes when you have patients weighing themselves every day, I think that's kind of a mindless thing to do, but it's really important from a standpoint as a cardiologist, a patient with heart failure. If their weight goes up by 3 or 4 pounds within a 24-hour period or a 36-hour period, that tells me that they're retaining some fluid. That's water weight. And that may be the first sign of their heart failure, even though they may not be short of breath. And so if they call us with that reported abnormality, we can make some adjustments on the telephone, hopefully prevent them from getting more symptomatic where they are so short of breath that they need to go to the emergency room, they get admitted for heart failure, and they get sent home. Hopefully we can prevent that admission process.
Is heart failure hereditary?
There are some conditions where if you look at the family, something called a dilated cardiomyopathy, where various family members have inexplicably this weak heart muscle, and the heart is a pump. And there are genetic abnormalities where patients are more predisposed to weaknesses in their heart muscle, and that's through genetic testing. So if you had a family member that was relatively young and diagnosed with symptoms of heart failure based upon just history, physical examination, diagnostic testing, and you found out, their sibling had heart failure, their parents had heart failure, maybe even their children, believe it or not, have a diagnosis of heart failure, then that really points you in a direction of a genetic abnormality. And within BayCare, we have the ability to refer patients to perhaps centers that have more advanced heart failure expertise to give those patients a better opportunity for treatment and long-term success.
Dr. Amin, thank you so much for your time and expertise and talking to us about heart failure and all that it involves. It's been a pleasure.
I appreciate the opportunity. Thanks so much.
And that wraps up this episode of BayCare Health Chat. Head on over to our website at baycareheart.org for more information and to get connected with one of our providers. Please remember to subscribe, rate, and review this podcast and all the other BayCare podcasts. For more health tips and updates, follow us on your social channels. If you found this podcast informative, please share it on your social channels and be sure to check out all of the other interesting podcasts in our library. I'm Maggie McKay. Be well.